very excited today at the Evans Blunt Center to host this summit. We're very excited about the partnership that UNCG and Mount Zion have put together in order to address the issue of access to care for the underserved. We're very proud of our Greensboro community, though, and our Guilford County community, because a lot of partners have come together to make sure that we have as much access as we can. Now, we also know, though, that even when all of us put together all that we can, there are still some gaps. Today we have in our audience Brian Ellerby, who is the CEO of Triad Adult and Pediatric Medicine. We call it TAPM. And we know that not long ago, HealthServe had to close. But we know that even when HealthServe closed temporarily, when they were open, there were days that they were at capacity. So there's still a need. There are days now that Evans Blunt is full. We're full most days. Our doctor sees 40 patients a day by himself. That's a lot for one doctor to see. And there are still people who need to get in. Since the summit, Reverend Cleveland, there have been doctors in town who have opened their own freestanding places. And some can see 10 patients a day, some can see more per week, and that's great, but we still need more. So what came out of the summit, one important message was that we all have to remain dedicated to providing health care for the uninsured. We have to make sure that there are fewer uninsured people so that the demand won't be as great. And we have to combine our resources because none of us have enough to do this alone. So we have to partner, do it together for the sake of our clients and for the sake of the patients in our community. The summit, as you know, as you'll see on your agenda, was held in November, and we do compliment Mount Zion, Reverend Cleveland, and Dr. Weinberg from UNCG for having this report ready for you today. You know that this report is going to the White House, and so Greensboro is gaining attention. The model that is used here at Evans Blunt and in other places at HealthServe also is the right type of model. It is a model that provides high quality care for an affordable price to a lot of people, to a variety of people. And that's what we like and that's what we need. So without further ado, we do welcome you on behalf of UNCG and all of our partners, especially Mount Zion, Evans Blunt, and all of you who are here. And right now, we're going to follow our agenda, and you're going to hear some very touching words, I'm sure, from Ms. Sharon Hightower. And we're so excited that Sharon is able to be with us today because before the Evans Blunt Center started, we had a neighborhood task force, community people who lived in Southeast Greensboro, who we went to and said, listen, our statistics show that there is a need for more access to health care in Southeast Greensboro. And would you all mind working on a task force with us to help us address the issue and decide what we can do? We wanted to be sure not to create something and then say, do you all mind using this? Mm-hmm. So we put the task force together. Sharon was an original member of it. And at that point, she wasn't even a city council member. And now she has risen, and now she's up there on that high city council hierarchy. But today, she's here to speak to us as an original member who created this model because this community needs it so much. Sharon?
Wow, I feel important after listening to Merle. But anyone who knows me know that when we mention health care, I immediately mention Evans Blunt. As Merle stated, I'm an original member of the Southeast Task Force. It was determined that the health care in 27406 was lacking and that we needed to do something about that. And so I wanted to pay homage to some of those on that task force who are no longer here. And I was on a task force with Nettie Code, Mary Black, Dorothy Brown, Otis Harrison. Those were the type of people that came together and said, listen, we got to do something about this. And we need to call attention to the fact that we have to travel a good ways to go. But as you look around the neighborhoods and we're getting older, we have chronic diseases and chronic illnesses and they need to be addressed. We need to talk about having good health care and understanding why it's important. We take our medicine, we make our doctor's appointments, but at the same time, we can't afford to pay the astronomical office visit prices and then return and then buy medication. And it needs to be affordable. And so we came together and we met for many, many weeks. We talked to various people, we talked to various providers, and we just determined to get this clinic open with the help of the Gifford County commissioners. They gave us funding. We found medical partners in the community and outside the community. So this has been a great partnership of people who come together, who recognize the need and the importance of health care. I tell people I'm an example of this clinic, because when it opened, and I think it's 2010, I was thinking this morning, because it's been about 3 years now, we're going on 4, I'm so excited about that. Right afterwards, when this clinic opened, I lost my health care. And so I'm a diabetic. I didn't have anywhere to really go that I could afford. Even though I'm working, I'm a working person. So it's not always people who aren't working that don't have insurance or can't go to the doctor. You know, there's the working. Medical costs are so expensive, and so you can't afford to buy a private policy. And so I'm so thankful for the Affordable Health Care Act that's coming into effect, so that people will have insurance and be able to see people here at this clinic, because I'm going to continue to promote Evans Blunt. And it's such an example of a fine institution in the community. We want it to be close by where people can walk to us. And so as we opened and we began to get the word out, people said, well, I can't go there, you know, I can't afford it. And I'm like, listen, you can go there because it's going to be according to what you make. And then we partnered with social services so that people could come in and have intake. We make it a one-stop effort for people not to have to leave here and go down and see about food stamps and other aid like that. So the county has been great in that regard because they put someone here. It's key, you know, that the partnerships between community and, you know, government, as you want to call it, or private partnerships come about so that we can have excellent medical health care. And as I was saying, you know, I came here and my diabetes is now being controlled, and I'm excited about that. It was cost effective for me to be able to be treated. And so I hope that as this initiative begins, it will take from this example of Evans Blunt that community has to be at the table of discussion when it comes to things that affect your everyday life, and that you'll go forward with that and create more models across this city, because even though we have Evans Blunt, there are still areas here that need other facilities that are affordable. And let's don't make the emergency room our doctor with the astronomical costs that they have. As you come in here and we come to Evans Blunt, we want to teach you how to take your medication, how to monitor your blood sugar, all the chronic illnesses that people find themselves in the emergency room getting, you know, drastic treatment, amputations, and heart attacks and strokes, those types of things. So I implore you that we will, you know, support this initiative. I implore those in the community. I implore those in the faith-based, county, government. We all need to get on board with this. It's certainly an absolute beautiful idea to mix the two. It's a grassroots initiative, and I love grassroots. Anybody who know me know I'm a grassroots person all throughout the community. And so when we talk about Evans Blunt, remember that Evans Blunt can be an Evans Blunt everywhere, on every corner, and I certainly hope that this will continue.
Thank you, Sharon. Sharon mentioned that we met for weeks on the task force. It was actually 2 years. The community was devoted to making this happen. We had meetings monthly for 2 years. And that's part of the model that I think that Dr. Weinberg and Reverend Cleveland want to show the nation, that when you put the time into it on the front end, it pays off on the back end. And if it looks easy to anyone now, it wasn't easy. It was 2 grueling years. We won't give you a blow-by-blow of all of our meetings that we had, Sharon, but they were intense, but they were worth it.
new partnership that we are about to engage in is just the beginning of the partnerships that we will have. The health system, the faith community, and the educational community alone cannot even begin to solve, manage, or prevent the huge problems that we have. But perhaps, just perhaps, by working together, we can be more successful in tackling the things that we can tackle. And there are things that we can tackle if we work together. And that's what our goal is. The main reason why we asked people to come today is that we are sending the report from the summit that we were asked to produce to Washington, because they were pretty impressed of the amount of work that we did to bring the community together. We weren't impressed. This is what we do. This is what we're supposed to do. And so we worked very hard. I want to thank my friend and colleague, Reverend Odell Cleveland and Vincent Francisco, Dr. Vincent Francisco, who worked so terribly hard, but there were other people in this room that worked terribly hard that I'm afraid I'll miss you, to bring this event together, to put the report together. So I just sincerely want to thank you. I will hand out the report in 1 second, but we did get an email the day before yesterday from Melissa Rogers, the Executive Director of the White House Office of Faith-Based and Community Neighborhood Partnerships, and she just simply said, Bob, we definitely want to see the report and stay in touch. Acacia Salati, Lisa Carr, and Heidi Christensen are added on this email from our HHS Center. I am sure they will want to stay in the loop as well. Thanks again for the important work you are doing, Melissa. Acacia Salati is the acting director of the Center for Faith-Based and Neighborhood Partnerships at the U.S. Department of Health and Human Services. She has already contacted us, and Reverend Cleveland, Dr. Francisco, and myself will be on a conference call with her Thursday at 11:30 to begin to have this community work put on into the national discussion. So again, I want to thank all of you, because it couldn't have happened without you. Inside the report, you can find 4 broad agendas that we are looking to do. Simply one of them is right here, to begin a partnership in the community. Along these 2 strips, Willow and MLK Drive, there are 14 congregations that you can count with your eyes. We don't know about the ones that are in the back of the woods and down Florida and around Lee. And then there's Mount Zion, where we held the summit. And Mount Zion and UNCG are partners, and now Mount Zion, UNCG, Evans Blount, and this community are partners, but not permanently. Perhaps forever, but it doesn't mean that this will be the only partnership. We are educators, and we are brokers, and we are people that want to work for community change. We have the resources, the skills, and the ability to help any center, any clinic, to begin to maximize collective potential for community health. That's what we're about. That's what the report says we're about. That's the model. So on that note, I would like to just mention one piece about community education, and that is that Reverend Cleveland signed a contract with Public Access TV. We had 79 workshop leaders from the community, like Dr. Dick Stein, and many others, that shared their incredible practice wisdom, and it turned it into an academic session about practice and best practices. We have 79. Now we have access to public TV that also has streaming capabilities, so that we not only can begin to educate the neighborhood and the public, but we can begin to, with some good funding, to begin to produce shows to stream anywhere and everywhere that we want. So as educators, that care about the community. We're going to spread the word while we're working in the community to help develop programs. On that note, I'd like to thank you once again for coming, and I want to hand out the report. And I do want to make one note that this report has 10 hyperlinks in it, meaning that there's a connection to 10 different web pieces of information. We just have the hyperlinks, so we'll have to give you the web address. There will be a there will be an address at UNCG's website. We already have one for Mount Zion, and I can read it to you. It's for those of you who want to write it down so that you can go to the hyperlinks and get videos like that. It's http://mtzbc Mount Zion Baptist Church.com/FCH. Okay, so when you see the hyperlinks, you won't be able to press them in your book. So this is the report. It will go out this afternoon to the White House, and then we will definitely keep the rest of the community informed about what happens, because this is not about us. It is us, but it's not about us. It's about us, all of us, about the community.
While the reports are being distributed, we will refer you back to your agenda. And now we have
To be here as a member of a faith community and a healthcare professional. I'm a speech-language pathologist by discipline and an educator. I feel like all parts of my life have come together, and it's quite an honor. I want to just give a sidebar to Merle that the son of the man who invented super glue is on our School of Health and Human Sciences Board of Visitors and is a retired physician. He volunteers to help teach our students. So it all is all coming together. I did want to acknowledge, although I represent UNCG and the School of Health and Human Sciences, both of which have an Office of Community Engagement, and Bob Weinberg directs our Health and Human Sciences Office of Community Engagement, which is this. But I want to acknowledge the 4 other colleges in Greensboro because we all work together, particularly in nursing and in health and human sciences. We have joint educational programs. You've heard about the downtown campus. We're all going to learn together. So I did want to acknowledge we at UNCG just jumped into this. Bob drug us into it. You know how Bob is. But we're very, very honored. I also wanted to, since I had the podium, to give a shout out to my colleagues in what we call allied health professions. 70% of the healthcare workforce is allied health professions. And so if you want to know what they are, talk to me. There are 240 allied health professions, and they're helping people be healthy and well in partnership with physicians and nurses. I also wanted to just kind of end by saying that it does matter what we believe, but more importantly, it matters what we do. And this is doing. And it is my dream that someday we can worry less about sickness and disease and concentrate on health and wellness. Thank you.
I bring greetings this morning on behalf of Temple Emmanuel and the Jewish community here in Greensboro. I want to just do a quick shout out to 2 of my rabbis, 2 of my teachers, and that is Dr. Bob Weinberg. It's okay to call you that, Rabbi Weinberg, and Rabbi Odell Cleveland in the back of the room over here. Of course, so many in the room here today are rabbis, teachers, if you will. And we have so much from here to teach about the blessings, right, of partnership, about trailblazing, about entrepreneurial spirit. One of the most familiar stories from the Bible, forgive me, I'm clergy, is that point when the Israelites just left Egypt, and they believe that they're free of Pharaoh's oppression, and they only and they get to that point where they get to the Red Sea, and you know what happens, right? They hear the sounds of Pharaoh's chariots bearing down on them. All of their routes appear to be blocked. Going back, we know, is not an option. They face there in Egypt either certain death or the shackles. And going forward also is not possible, because the sea's waters will surely swallow them up. But we know what happens next. Moses is told by God, lift up your arms, and then the waters part. It seems like there are times when we only look for the divine bailout plan. There's another story, though, that's told in the rabbinic tradition. A little known character, his name is Nachshon. This is not going to be on the exam at the end. He was there too. And he's standing there by the sea, and he was sick and tired of being a slave. He was ever so trusting that redemption was to be found not in what was, but in what lied ahead. And he told his friends, that's it, I'm going forwards. And you're nuts, is what they said to him. You're crazy. But he started walking into the waters of the sea, and some of you know this story. As he did, the waters began to surround his ankles and then his knees, but he kept on walking. He heard Pharaoh's rejection all too often. Water then came up to his midsection, his chest, his neck, but he kept on going. All the while, those watching were sure that he was a goner. But all the while, he, Nachshon, remained convinced that something better was ahead of him. Water enveloped his chin, then it came up to his nose. And as he went underwater, Nachshon did, the bubbles of his breath formed on the surface. And it's at that point that the rabbinic tradition says that the waters parted. A trailblazer. I share this little-known story about the parting of the Red Sea because I believe that we are standing here today on very sacred ground at a Nachshon moment. Either that, or we are here with the modern-day versions of Moses and Nachshon sitting among us. You can choose who is who. They are the trailblazers. Drs. Weinberg, Reverend Cleveland, so many others. These guys, I think we know, are known as Frick and Frack. You can call them Moses and Nachshon. I'll leave it up to you guys to choose who wants to be whom. When others said, stay here, we have no options, well, we knew otherwise, right? When others said, we have the answer ourselves, we can go this alone, well, you urged partnership and working together. And when others said, no, this is not possible, you said, and I'm sorry for the tired cliche, yes, we can. And so this morning we ask for God's blessing upon this holy endeavor and this holy space. May its challenges be good challenges, and may its successes be many. May others look upon it as they do the story of the parting of the Red Sea and find inspiration. And most importantly, may those who need the health care and the other services with presumably little to few other options, as we've heard, find new possibilities here at the Evans Blount Community Health Center. May they, the ones who need it most, be blessed with goodness and healing. And together, let's all say, Amen. Amen. Thank you.
I want to first start by saying thank you even for this opportunity to come and share some of the things that we're doing as a faith-based organization here, right here in this community. My name is Kevin Webb. I'm the pastor of Love Fellowship Believers. We do not have our own building, but what we do meet is right here at Gillespie Park Elementary School, probably about a block away from this very area that we're standing in. The elementary school there that we deal with, one of the problems when we first went to the elementary school there with Principal Stone was that he said there was a problem with food. They didn't have food. And so they were giving out food to students in book bags when they were leaving at the end of the day. And so that let us know that there's definitely a different type of need other than what we originally thought when we came to this area. I live in Northeast Greensboro. I live in a food desert. I live in a place that needs an Evan Blunt Center. I live in a place where demographically income is not where it probably should be. I live in an area that folk call me all the time as pastor and say, I don't have medicine, I don't have food, I need help with this, I need help with that. I deal with mental health issues. I'm not a physician to be able to do that, but have all kinds of different needs in our community. Reverend Cleveland, I've known him for quite some time. I'm trying to remember the other day exactly how we met, but I don't recall. But ever since we have met, we've been working together, and he calls me on things, and I call him on things, and we're there for each other. He called and said, hey, there's a health summit going on. We had different members come from the church in different areas, and came back and gave a report and were ecstatic about it. Actually, some of the things that were talked about there, that curriculum is also being implemented this year in 2014 at our own church. I didn't realize how many different things we were doing with our faith-based organization. I didn't realize how many different health aspects we were involved in until I actually took the time to sit down and write it down. It wasn't because it was something that we were trying to do to be a trailblazer. It was just something that we needed to do because we had people in our congregation that needed it. Our vision for this year is let's do the work, to actually be active, determined in our obedience to do what it is God will have for us to do. And although we can stand and we can preach the word and we can do all of those different things, Jesus gives us so many different examples of how he met the people's need and met them where they were. We have CPR, AED training that's happened at our church. We've been awarded many grants that awarded us AEDs. We have a Grow Your Own ministry, that helps to teach literacy, as well as growing a community garden. The whole aspect of that is not just to have a literacy program, not just to have a garden, but to also change a lifestyle and how people approach their lives. Instead of having to wait until you're 50 or 60 years old to say, hey, you need to change what you're eating, why don't we start with our children and have them to start eating the right things now so that later on their health will be better. We're also working with a teen advocacy program right now to get a mini grant to help us with our teens, to get our teens involved. Folks say that our teens are out in the street and they're doing all kinds of stuff. Well, yeah, there are some kids out there that's doing things that they don't need to be doing. But you know what? What are we offering them? What are we giving them to do? So we're going to take that program and we're going to implement that. I just really appreciate the opportunity to be able to be here today to talk about the involvement of a faith-based organization. We're here in this community, and we're here to do whatever it is. We're looking for more opportunities to share. With that being said, next Thursday on the 16th, we've partnered, and we're going to have someone to come out and talk about the faith-based organization, to come and talk to our faith-based organization about the Affordable Health Care Act. The representative from the Nonpartisan League of Women Voters in the Piedmont is going to come out, and they're going to talk to us, and they're going to help us so that we can go ahead and talk to our community. We can talk to our members. We're open to anyone and to everyone to come. There's a whole auditorium, I believe it sits 300, 400 people to come on out and to listen to what they have to say and to answer questions. Again, as a faith-based organization, I think that is definitely key to what we're doing. I like the report that talked about the trust that's there. There's people that come there every single week. There's phone calls that's made every single day. Just last night, someone called and said, hey, I don't have any food. Just this week, someone called and said, hey, they tell me that I need surgery, but I don't have what it is that I need to get the surgery. What am I going to do? And so this is something that happens every single day. My wife works for Department of Social Services. She's a supervisor at food stamps. Every single day, she's having to tell somebody, no, you didn't get your recertification. No, you didn't get what it is that you needed. I work for the county with Public Health Director Merrill Green. Actually, once I leave this meeting today, I'll be going over to her department to do some work there. There's folk that come in. We have a young lady that's a member who's pregnant, who didn't have the insurance that she needed. Needed to go over to the public health to get what it is. Fortunately, she was one of the lucky ones that got everything that she needed and was able to get everything. But it doesn't always turn out that way. We've also partnered with Moses Cone in the public health department with our lay health coaches. Not only do we preach every Sunday, not only do we teach every Sunday, but we have a segment in our church called Healthy Living. Healthy Living comes every single Sunday. People look forward to it just as though they look forward to anything else, to come out and find out what is it they have these lay coaches learned over at Moses Cone that they've come back and sharing with us that we can do to help live a better life. There's so many different things we can do within our faith-based organization. And again, I'm here as a representative of Love Fellowship Believers, that we are wanting to do any and everything we can to help out. Thank you.
Today's healthcare model does not work. First of all, I'm Sherry Dickstein, retired OBGYN. I practiced in Greensboro for 30 years before I retired almost 2 years ago. So today's healthcare model, I feel, does not work for much of the poor and underprivileged in today's society. The wealthy have access to our medical model. They can negotiate the medical system, find doctors of choice, drive to any facility of health or to see any doctor or healthcare provider that they want, and take advantage of everything Greensboro has to offer. They are mobile and can afford to make healthy choices. The Affordable Care Act will help many get access, but will not solve all the problems. As a physician for almost 30 years, I spent my days discussing with women how can they maintain their health. And what I said was, eat healthy, exercise, don't smoke, don't drink to excess or use drugs. And that was, even though I was a gynecologist, that's what I said day in and day out. Well, how can this be implemented in Southeast Greensboro, Northeast Greensboro, the areas of Greensboro that can be underserved? Eat healthy. You can't eat healthy if you don't have access to fresh foods that are not processed. If your only choice of a beverage to buy in the only store within walking distance, since you might not have access to a car, is soda or a drink that has sugar, you are at risk of gaining weight or developing diabetes. To exercise, you don't need a gym, but you do need to feel safe. And you need to have motivation from peers and the community to persist within an exercise program. Don't smoke. This is often set by examples of peers and relatives. Well, we know that there is a higher percentage of smokers in the lower socioeconomic group, but this could change. Don't drink to excess or use drugs. Again, this is higher in the lower socioeconomic groups. And this needs to be set by example and setting a safety, being able to maintain safety in our community to decrease this. The solutions to our problems, to our healthcare problems, must come from within the local community. Since our standard medical model really has failed our indigent and our working poor. The Healthcare Faith Summit has shown that the community cares and is willing to help and make changes and to provide what the community decides we need or they need. This is really very exciting. This is really a beginning. There are many resources upon which we can draw as seen in the summit. There is interest, excitement from many areas within Greensboro. But really the solutions are not what we are going to tell people. They really have to come. As you said, it's a grassroots development. It has to come from the grassroots organization. And they are solutions that perhaps none of us have ever thought of. But we can do it. We need to work together, we need to listen, we need to be able to implement new ideas. We actually really can become the healthiest community in Greensboro. Thank you.
Good morning. I'm Susan Shoemaker, president of Cone Health Foundation, and I'm happy to be here, and the foundation really applauds the efforts of Dr. Weinberg, Reverend Cleveland to further engage the faith community in our shared goal to increase access to health care. Their efforts really align with the work that the foundation has been supporting for the past 16 years through an investment of more than $62 million. Greensboro is also really fortunate to have a strong safety net of providers such as the health department, this clinic, Triad Adult and Pediatric Medicine, Guilford Community Care Network, Immigrant Health Access Program, Partnership for Community Care, the Congregational Nursing Program, which has been referenced, and many, many other dedicated providers. However, with nearly 20% of our non-elderly population uninsured, we need everybody in this room and everybody in this community to gather around the table and work collaboratively to increase access. And so thank you for this effort to make that happen. The foundation, the health system, will continue to support efforts to provide quality care to individuals regardless of their ability to pay, but we have 80,000 folks in Guilford County who don't have health insurance, so it's truly going to take a village. We do have some hope on the horizon, though, with the efforts of the Faith Summit, and now with the health insurance marketplace open until March 31st to enroll those without access to care. And I have to get a plug in for that. The website is working better, much better. So I hear from our navigators. We fund a number of navigators and partners to provide navigation. You've got cards in your chairs, and there's some on the desk. There is a toll-free number in North Carolina that anybody can call and can make an appointment to meet with the navigator. They can get in-person assistance. They can get help online. So there are resources. It is not going to solve our entire problem. The financial help is available for folks with 100 to 400% of the federal poverty level. So that leaves many uncovered, but there is help. So please we all have friends, family members, relatives who don't have health insurance, and this is a possibility. You can't be denied any longer as of January 1 for pre-existing conditions, which is exciting. So a lot of good news in the law, though we've got lots of tweaking to do as well. I think the bad news that even with the marketplaces open and accepting applications, we will still have many, many thousands in Guilford County that will be left without health insurance coverage until North Carolina expands Medicaid. And many don't know that under the current Medicaid program, if a person is between the ages of 18 and 64 and does not have a serious disability or is not the parent of a young child, they cannot qualify for Medicaid coverage regardless of how poor they are. So as Sharon mentioned earlier, there are many, many, many working poor that don't have access to health care. In closing, I'd like to say that for those of us, and this is to tap into Dr. Dickstein's comments, for those of us with health insurance and money to pay for our deductibles and copays and medications, we have an excellent health care system in our country. I experienced it firsthand this year. I was diagnosed and treated for breast cancer, doing great now. But every time those medical bills would roll in, I would think, they were overwhelming to me, and I would think, how do those feel that don't have health insurance, that don't have the ability to pay those copays? And it just made such an impression on me. And research shows from the North Carolina Institute of Medicine that the uninsured face a 25% higher risk of death than those with coverage. That disparity is unjust and unfair, and we can do better as a state and a country. So thanks again to Bob and Odell and everybody around the table for your focus and effort to expand access to care and make this a community endeavor.
Good morning. That's, who's the choir director in the room? We need a little bit more spirit. Thank you so much, Susan, for this. I get calls almost daily about how do I get into the system, what do I do. So now I'll just keep those numbers right in front of me and be able to work with that. That's a great resource. And again, good morning to everyone, and thank you for letting me be here this morning and to hear already some good points that I can take forward. This is great. I only took a quick glance at the report, but already my mind is wheeling about how I can get this out to an even broader audience. I know some of you know, but some of you don't. I serve on the National Board of Directors for counties. So, in fact, just this week I was in Washington for 2 days as we did strategic planning, an 18-month strategic planning session for our counties across the U.S. Healthy communities is one of those emphasis areas. So I will talk with Reverend later and Merle, and see how we can maybe get this out across the country as a model, because I think we need to take it to the county. That's the ground level of government. The county and the city is where the citizens come to us. We can't get away from them. We're not in Washington and out of sight. So, but it's where the people really need help too, and we can get that to them. I just want to give a few words of appreciation to thanks to each of you who have been involved in addressing this community health issue. And I do have a lot of allergies to deal with, so if you'll excuse me if my voice just goes away. And not only addressing it, but actually doing something to help our uninsured and lower-income citizens. They're our neighbors and our friends and those who need us. And, you know, we're honored to be able to help them. To thank you to Councilwoman Sharon Hightower. And also I would be remiss if I didn't recall all the hard work that Commissioner Carolyn Coleman and former chair of our board, Skip Austin, did to get this center, to convince the Board of Commissioners. You didn't have to convince me. I mean, I know when people need help, you need to try to help them. But to actually get this center up and running. I also want to especially thank Reverend Cleveland and Dr. Bob Weinberg for their leadership in this effort of trying to get health care, and to congratulate you on the recognition you're receiving from the health center. And that recognition also applies to the whole community. You know, when the summit receives recognition, it's referring to Greensboro, it's referring to Guilford County, it's referring to North Carolina, and that we can all take pride in, I think. And I also want to thank Rabbi Gutman. I'm sorry he's not here, but Rabbi Gordon, if you will please take him with the message, for calling and inviting me to that Wednesday, October 9th meeting over at Holy Trinity. When he called, I thought, well, now I've got another thing I need to be at, but you know, the rabbi doesn't call often, and I listen to the rabbi when he calls because I know that he's a busy man and he always, you know, there's something of substance there. But I thought, you know, I don't know why he wants me to be there because I'm not sure what I can do, because he was talking about the upcoming summit. But when I got there and I heard the discussion, and I heard Rabbi Gutman and then Tim Kluntz and then Tim Rice all make reference to a need for transportation assistance, I knew why I was there. You know, sometimes, you know, things just work in the right way and put you in the right place. And it just seemed like a perfect fit. The county had vehicles and drivers, program already in place, so why not offer it as a potential answer to at least part of the problem that they were presenting that day? So I did that, and we set up a meeting, and the wheels started to be in motion. And it's my understanding that it has been working and working well. So sometimes, you know, you just happen to be in the right place. And I say sometimes I ought to sit on my hand more, but that was one time when I was happy to stand up and raise my hand and say, wait a minute, maybe we can plug in something here. And we know at a time when resources are scarce and our citizens' needs are many, that we must look at different ways to meet those needs. We must stretch our minds and think out of the box and take on an attitude of, we can do this. And then we might find that, as the little ad that we see so much with the guy with the children, that it really isn't that complicated. You know, we can find a way. People helping people. And that's one reason for our being here. Collaboration between groups works. This project being celebrated today shows that each individual entity can be a part of support through services already in place. As county commissioners, we want our citizens to be healthy and to have access to good health care. And we all know that when we all work together, a greater vision can be accomplished. So let me thank you again for all the work you do. And I know that everybody here has played a part in making our community a healthy community, and the total community will be better off because of that. So thank you again.
Thank you, and I will be a Jewish rabbi. I think Sammy Davis Jr. was the first black Jewish rabbi, I think. I don't know. It was the Pope? Okay. You know, it's interesting that when you sit here and you think about all the things that we've done, Bishop Brooks, from 20 years ago when you first allowed me to be in charge of the prison ministry at Mount Zion, and all the things, and you told me that if I messed up, you were going to fire me. I appreciate that. as I get calls from different parts of the country now, they're talking about, how did you all do what we do, Rabbi? And Dr. Dickstein, what we do is not a big deal per se. When you think about the report and you read the report, there's no new information there. When you think about the university, we've been privileged and blessed to teach students, which is so important, Vince. We teach them from our book on community engagement because we understand that we're planting trees that we're not going to enjoy the shade. We understand at 53 years old, probably not going to be here at 106. Even though I'm going to watch my diet, Dr. Dickstein. I'm an exercise Dr. Dickstein. I'm not a smoker, Dr. Dickstein. I'm not a drinker, Dr. Dickstein. But that macaroni and cheese, Dr. Dickstein. Y'all got to pray for me on that macaroni and cheese. So that's how the universities come into play. But now you think about it, the medical community. They're asking, why is the medical community involved? And it's this little thing called the Hippocratic Oath. That's how you get the medical community, because that's your holy scriptures. That's why you're here today, Dr. Funderburg. That's why. We don't have to make people come. People are already committed to come, Susan. We just have to give them something to come to. When you think about those of us from the faith community, since I'm Rabbi Odell Cleveland today, do I get one of... Okay. I always thought Rabbi Gottman used that to cover his bald spot, but that's a whole nother deal. Yes, tell him I said it. But when you look at our holy scriptures and you think, whether we're looking at the Torah, the Quran, the Bible, all the holy scriptures, and then we think about this one story. Think about one in Luke. We refer to it as the Good Samaritan. I think it's a situation where they say that coming down from the road from Jerusalem to Jericho, they say that the traveler fell among robbers. And Dr. Weinberg, they said they robbed him, they beat him, they took everything and left him for dead. Then they said that a priest came down the road. I say a Baptist preacher or a rabbi from the Jewish community. But those religious leaders, they said, walked around him. He was on one side of the street and they walked to the other side of the street. Just like many of us might walk in here or walk out of here and we see somebody at that door and we might go to the other side because we're not used to seeing people on the Jericho Road here that we call Martin Luther King Jr. Drive. As sad as it is, in most communities, when you say Martin Luther King Jr. Drive, you're talking about Jericho Road. You're talking about a certain side of town. Nobody don't say it. I don't have sense enough not to say it, Fred. And you have to be careful who you help and who you come against when you're on the Jericho Road on the east side of Greensboro. You have to be careful. You're going to have it where, Odell? You're going to have it at Evan Blunt? What's wrong with you? Evans Blunt? Why not Evans Blunt? If we walking through the scriptures, and then later on, said a Levite came down and walked on the other side of the street. Can't get involved, can't be involved. Maybe the Levites, maybe the university. Coming from the ivory towers, coming into the community, can we play community engagement? That might be the Levites, go the other way. But then the scriptures went on and said, it was a Samaritan. Said the Samaritan saw the need. Maybe that was your group who was coming together for 2 years. And I know you argued because I know you like to argue. I could tell you like to argue. But I like to argue too. That's why I love you. So the Samaritan stopped. And they said the Samaritan went and bandages his wounds. It says the Samaritan took oil and wine. Dr. Dixon, you said folks can't drink. But he said he had oil and wine. Excess. Oh, thank you. Macaroni cheese in excess? He said he took care of him. And then when he got through, and the ironic thing to my Jewish brethren here is that the Samaritans didn't get along with the traditional Jews at the time. Somewhat, right? Give me an amen. It's okay. So if anybody shouldn't have stopped on Martin Luther King Jr.'s drive, it shouldn't have been all of us. If anybody shouldn't have came over here today, it shouldn't have been Dr. Sherry Ditzstein. Why did you come? Why did you stop on Martin Luther King Jr. Drive? Why did you come over here today on Martin Luther King Jr. Drive? Don't you understand this is Jericho Road? Then he stopped, and they said he put it on his beast. He got off of his beast, his form of transportation, put the injured person on his form of transportation, and took him to an inn. That's why I get frustrated sometimes when I hear that we're fighting over what inn is the person who's hurt going to. Is he going to Evans Mont? That's just one inn. Is he going to Cone? That's just one inn. Is he going to Cornerstone? That's just one inn. Is the person going to Health? That's just one inn. That's not the inn. That's one inn. We have enough poor people in need to fill up all the inns. And we're fighting over who gets the money for one inn. Y'all got to help with that now. Because we're wasting resources. We're drawing lines, building walls. We're making enemies when we don't have time and we don't have the time, talent, and treasure to waste it fighting amongst ourselves. Then the Samaritan took him to the innkeeper. And he stayed there. The next morning, I think this Holy Scripture says, he had 2 shekels, 2 silver shekels. Gave it to the innkeeper. I guess that may be a copay. And then he said, I'm going to tell you what. You take care of this individual. Because, see, sometimes things happen when you're minding your own business. Sometimes breast cancer happened to my mother, so I understand. Minding your own business. Sometimes mental issues happen minding your own business. They said the traveler wasn't doing anything wrong. No blame. The traveler was minding his own business. But he fell upon the robbers. And so now the Good Samaritan told him, I'm his insurance policy. When I come back, I'll reimburse you for everything you did. Just take care of him. So what we're going to have to say in this room, we're going to have to be Greensboro's, High Points, Guilford County. We're going to have to be somebody's insurance policy. I know I ain't much, but I'm going to have to be somebody's insurance policy. So it makes me uncomfortable to hear Odell Bob, Odell Bob, Odell Bob. Yeah. But it ain't no Odell and Bob. It's us. So he told the innkeeper, when I come back, I'll take care of it. And he did. As I close, I'm going to ask Bishop Brooks to come up for a minute. Because, see, this is the man, when it wasn't an Odell Cleveland, he was my insurance policy. He helped me, he supported me, he nurtured me, he mentored me. And Bishop, my little bit of time left, I'm going to ask you to share, why did you care about this community enough to take a Geechee from South Carolina, who you really didn't know, and allowed a Jewish rabbi, Dr. Bob Weinberg, to come into Mount Zion Baptist Church, a traditionally black church. And you allowed all of us to come in. You supported us, and you covered for Bob. When many said, what's this white Jewish guy doing in the black community? Come on now, in the black church. Come on, talk about the Samaritan. The Samaritan stopped. Folk who shouldn't get along, they got along.
All right. How about just set me up? I just want to say a couple of things right quick, and then I'll move expeditiously toward an end. You notice the rabbi talked very softly, very gently. The Baptist preacher yelled, so I'm going to be somewhere in the middle. So just want to let you know. Well, Odell, let me just jump to the issue instantaneously. Well, in order for me to really tell you why that happened, I'll have to go back to the fact that I served in Vietnam. And I lived in Hillsborough, and I came from Vietnam, and I was in Raleigh-Durham Airport. The businessman came in, and he said, I was coming in on my way straight out of the field of Vietnam. I left Vietnam on Thursday, was back in the States, and was back home on Sunday. I had no time to debrief and some other stuff. So I came in, the businessman was trying to catch a flight, and he says, those damn veterans just taking up all my flights. Well, it angered me. I left there, went home, lived in Hillsborough, went home to my dad and mom, saw who they were and how they were doing. And in so doing, there was a Ku Klux Klan rally 5 miles from my home. Well, just coming out of the fields of Vietnam, I had a kind of intensity in me that had not yet been managed, is the best way to put it. And so my goal was to eradicate hate. So I got the gun from my father's closet, and I was out the door, and my dad said, son, the best way to kill hate is to love. My dad was a pastor. He said, I would suggest to you, you take the gun, put it back in the closet, and find a way to love past any hate there is. Consequently, I got in my car, drove by the Klan rally, came to Greensboro, and I developed a relationship with a gentleman named Hardy Callicut, who was a white guy from High Point. He became my mentor. He loved me. He had 3 daughters, no sons. He loved me, and he called me his suntan son. And in so doing, from that point, I learned along with Hardy and the fact that my dad came, his father, straight out of slavery. My mother is a mixture of Native American and white, and so here I am, a conglomeration of all of that. How in the world dare I hate anybody? And when I saw the need, and when I saw you coming from an area that was poverty-stricken, the first thing I saw in you was love. And when you see love emanate from anyone, how dare you reject it regardless of their condition in life? And for me, it was simply a step of saying, this is what the world needs. That's why God made us, because God is love. And anything that inhibits, prohibits, or rejects love has to be hate and hatred. I dare not trust myself to carry hatred. And based upon that, I saw in you potential. I saw in Bob a guy who wanted to be an Italian artist that did not know how to wear his hat. And so he turned it around backwards, and he talked with great distinction. And then the greatest of all things, Gene LaBauer, who's my personal good friend, we talked about the whole issue of why we were where we were. And I saw you as an opportunity to bridge some gaps and to make some difference in who needed it more in Southeast Greensboro.
Thank you.
Thank everyone for coming. I'm just really full. I have one of my favorite comedians. Whenever he hears something religious, he goes, does that count for church? So that he can stay out on Sunday. So I think I had church today. So if I'm not there, Bishop Brooks and Reverend Cleveland on Sunday at that 7:30 service, I think I had church today. But anyway, thank you for all that you do, and definitely continue what we do. None of us can do it all by ourselves. The model is going to Washington. The report is going to Washington. The report is going to also stay here in Greensboro, get more copies, I'm sure, if you would like to. As Bob said, it's also, there are some websites in the report. There are some linkages, so do all of that. And all of us are continuing to be one community here that is working to increase the access to health care in Guilford County. And thank you so much for coming today.
Thank you.
Thank you.